Hugo, one of the things we're looking at in the low back is the general relationship to the slide between the multifidus, the longissimus muscle, and the rest of the extensor group in the low back. Originally came in with neurological symptoms, shooting pain down the leg, tingling, numbness, achiness, correct?
Correct.
Correct. So within a very short period of time we were able to take care of the neurological symptoms, allow that sciatic nerve to slide efficiently in and amongst the hamstring tissues. Right now we're going to work with the actual low back structures, just seeing if we can engage those tissues and create that slide between the bellies of the muscles. Cross your arms for me, Hugo. I'm going to ask you to lean back for me, please. You're going to rotate towards me. Good. We're going to come back. I'm going to ask you to lean forward, tucking your chin. And what we're doing over here is I'm working on the multifidus, which is a lateral extender and rotator of the lumbar spine. Good. Come back. And we're getting it to move. Pull the shirt up over here so we can get an idea of what that looks like. Okay, I'm going to go straight at the extensor group. Lean back for me, Hugo. Go all the way forward, now touching your toes. Bring and catch the head. All the way down. And what I'm doing is working right across the dorsal sacral ligament. Oftentimes in athletes, people are on their feet on concrete. The dorsal sacral ligament, as it crosses and traverses the lumbar spine into the sacrum, becomes real rigid, almost kind of like a piece of leather. So you got to break those fibers, those myofibroblasts free so that the tissue doesn't continue to adhere, and it frees up that lumbar spine because it's supposed to be independently from the sacrum. So go ahead and sit up. We're going to work the multifidus on this side as well. You're going to cross your arms for me, Hugo. Thank you. I'm going to have you arch your back and lean into me. Let me catch your weight. Thank you. Roll forward, and we're going to twist and tuck your chin and get that virtual slide to occur. He originally came in probably pain level upwards between an 8 and a 10. Extend back towards me, lean back into me, now lean forward and turn your body right off of that multifidus. Good. Okay. Go ahead and move around, tell me where you feel the pain now, better, worse?
It's better, yeah. Like earlier, like I was having a hard time doing this. Yeah, it's...
Okay, go ahead and lie on your left side. What we're going to get into is the external and internal rotators of the hip, primarily the femur head and the structures that attach to the greater trochanter. So what we're going to do is bring this leg back in full extension. We're going to bend it forward, bending the knee, and we're going to rotate the ankle towards the floor, lengthening the piriformis lamellae and external and internal rotators. Come back. And again. And what you want to do is really make sure that these fibers free up. So you want to hold at the very end and allow that neuroelasticity to occur and allow that fiber to start to free up and stick. That is stuck to free up. Good. Come back. When these are free, the patient will typically demonstrate an improvement almost immediate, and they'll even give you a little feedback by saying, that feels pretty good, doesn't it?
Yeah. There we go. And we're going to hold there for a count of 3. 1, 2, a little more rotation. And 3. Okay. Go ahead and sit up and let's try that again. Again, it's treat and train, treat and train. There's no smoke and mirrors. He needs to get off that table and notice an immediate improvement. We have to fix it. Yeah.
So how does it feel now?
Feels good. Feels a lot better.
A lot better.
Really.
So the neurological symptom, numbness, tingling, that bad ache that you had, that's virtually gone,
Yeah,
correct?
yeah.
Nothing. All right. I'm going to have you sit down on the very end. And what we're going to do is we're going to adjust the thoracolumbar spine, the thoracic spine. By doing so, we're keeping those nerve roots from being irritated. He's an athlete, does a lot of compression exercises, squats, deadlifts, those particular types of things. There's a lot of pressure on the spine. So proper mobility of the spine is essential for a pro athlete, someone like Hugo. So I'm going to kind of bring that back and nice, comfortable. There we go. And excellent. Okay, that's Hugo's treatment. I appreciate your time, my friend. Thank you very much. We're going to put him on a little bit of ice, and that's probably all for the treatment for him.